Oops. Oh. Testing. Can you all hear me out there? Yes. Okay.
I hear you loud and clear, Ivy.
Thank you. I have 4:59 on my phone.
Yeah. We should have a quorum, right? Looks like we got a lot of phone numbers on there. People
Yeah, I
calling in.
see all the names though.
Yeah.
But I think Toby couldn't make it, but other than that, I think we'll have everyone. Mike was running late.
Madam Chair, Mike might be running late. He's on the road. I see Dr. Cornell just joined. Hello.
Okay, I have 5 o'clock on the nose, so we'll go ahead and get started. I will call this meeting of the Board of Health to order. And can we get roll call?
This is Taylor Eden. If you guys could just say your name.
Ivy's here.
Cindy Shaw.
Seth Cornell's here.
Toby will not be making it. Mike was running late. Do we have Julie? Aaron, did you hear from Julie today?
Hey, Karen.
Hi, are you able to join the meeting?
I'm trying. It says I have to wait for a registration, or do I just call the 497-509?
No, you want to participate. Do you want me to send the link to you?
That'd be great. I've registered for the link, but it hasn't kicked back to me.
Well, I didn't have to register. I just got on.
Weird.
Let me get this to you because we don't have a quorum.
I apologize.
Three choices. The first choice was a link, but it only works if you're using your computer or laptop, not a phone.
Are you on a computer, Lynn?
I am. I'm on both, so
Hang on.
I can absolutely use the computer.
Hang on. Okay, I just forwarded it to you.
Okay.
If you just click on the link, you should be able to get in.
Okay.
Forgive me, Madam Chair, I'm trying to get a quorum. I'm not on mute, as it turns out.
No problem. I am.
Lynn Enkelman is attempting to join. She couldn't get in on the link provided, so she is trying now.
I just sent Jason an email address just in case we need to go that route. So we'll see.
Okay.
It looks like it's installing, so.
Apparently, Lynn's WebEx is installing, so we're attempting to get a quorum through Lynn. I did not hear from Julie Hart, Madam Chair. Mike is on the highway and attempting to join whenever he can. And Julie, and Dr. Richards obviously had a conflict this evening. So I think with Lynn getting in, I think her WebEx is installing.
Okay, we'll just give that a moment. Hang in there.
Okay.
Sorry for the delay.
No apologies.
Lynn is installing, Madam Chair, so she's getting there.
There she is.
Apologies, guys.
So, okay.
You guys
So-
hear me okay?
Yep, we can hear you.
Perfect.
Okay, so with 4 members of the board, we have a quorum. Before we open it up for public comment, I'm just going to go over what we're contemplating tonight and a little ground rules for how we'll run the meeting. We have one action agenda item, and it is the Board of Health is asked to authorize rules and regulations related to the COVID-19 event. I'm just going to run through very briefly what those are before we move on to public comment. The rule basically establishes a local face covering mandate and continues with 50% capacity at establishments, 10 p.m. closure times, health department approval of any event with more than 25 people. These would continue unless we hit some benchmarks in our positivity rates. So that would be positive cases per 100,000 needs to be at 25 or less for 2 weeks. The positivity rate needs to move to 10% or less for at least 2 weeks. If we achieve that for 2 weeks, then when we would move to continuation of the face covering mandate, 75% capacity at establishments, a 12:30 a.m. closure time, and health department approval of events with more than 50 people. And then we would move to remove the restrictions entirely if we get to a positivity rate of 25 or less for at least 3 weeks, and so 125 or less for 3 weeks, and 10% or less for 3 weeks. So then we would remove the restrictions. Sorry, I fumbled that last one a tiny bit. Okay, so the next item on the agenda is public comment on any item on the agenda. I have a number of comments from people who emailed or left messages today. So I'm going to read those into the record, and then we will open the phone lines. Okay, there goes. First one is from Beverly Hartline, PhD. On behalf of my husband, Fred Hartline, and I want to express our strong desire that the health board extend the local restrictions that have started to demonstrate success for limiting COVID-19 spread. We are all tired of the pandemic and how it is damaging our economy, health, mental health, and community. Unfortunately, the damage will only worsen and extend if we relax restrictions now or early in 2021. These restrictions have just started to show success. Diagnosed cases and positivity rates are going down. They are still unacceptably high and very fragile. It would not take much relaxing of mask use and restrictions on gatherings, including bars and restaurants for COVID incidents, to grow rapidly, rising even above the recent levels. Continuing the restrictions will help St. James maintain its capacity to treat COVID and other medical conditions, rather than needing to turn people away. Quality and available medical care is essential to the BSB community and much of Southwest Montana with more limited healthcare infrastructure. Our healthcare workers in all settings are still stressed and barely able to keep up with the demand. Let's not burden them further and unnecessarily. We are not out of the woods on untimely COVID-19 deaths, tragedies to the affected families and friends. With Christmas and New Year celebrations around the corner, we urge the health board to continue the restrictions by approving the proposed board rule and make sure that they are in effect at least through the month of January, by which time the effects of the pandemic and New Year celebrations, the return of tech students to campus, and vaccine use will be clearer. The way COVID-19 works, with highest contagiousness prior to symptoms and with many infectious individuals showing no symptoms, by the time data on the next surge are evident, it will be too late for control measures to save many lives. Thank you for considering these views. Sincerely, Beverly Hartline, PhD, Frederick Hartline, PhD. Next is from Dr. John Ray. The people's safety is the highest law, Cicero. I wholeheartedly endorse the proposal that Butte extend the mask wearing requirement and other protective measures in Butte into the new year. I would like to focus on masks, the wearing of which is paramount to protect public health. We cannot rely on personal responsibility, however attractive that may sound, because not everyone is personally responsible. In society, under government, we enact rules and regulations to protect the public health and safety. We generally call these laws, which command that we either do something or refrain from doing something with a penalty if we fail to comply. We do not rely on personal responsibility instead of law. Why? Because some people don't care about others. Some people don't know what to do without guidance. Rules hold society together. In the case of this pandemic, the actions of only a few can harm the many, and government is supposed to promote the general welfare and common good. Simply because someone can do something does not mean they ought to do something. I may be able to speed in a school zone, but that does not mean I ought to do so. I may be able to rob a store, but that does not mean I should do it. There are so many examples of the above where individual freedom to do something is constrained by law, rules, and regulations. Excuse me. We enter society for the benefits it provides us, protection or justice. Doing so, we give up some freedoms in order to achieve these benefits. The fact of living in society limits individual freedom. There is no clearer example of this general concept than relates to the current pandemic. But let me return to masks. It is uncontrovertible that 1, coronavirus is prevalent, persistent, and pernicious. It is more infectious than originally thought. 2, coronavirus can be spread by those who are asymptomatic. 3, masks are protective. 4, because a small minority not wearing masks can infect the many, the public wearing of masks must be as close to universal as possible. A reliance on voluntary wearing of masks would not be protective of the public. As I said, it only takes a few to infect the many. We cannot rely on what people ought to do. Decisions must be based on what people actually do or do not do. The argument against wearing masks has become politicized and is not based on data or facts. To the contrary, data and facts show that masks are a necessary public health protective. The political argument is made that I am free to do what I want to do, but such a statement is contrary to the facts of society. Government constantly limits individual behavior in order to protect the public. Just look at all of the public health ordinances. The American political philosopher John Dewey describes a public problem as occurring when individual actions have public consequences. Infecting others is a public consequence. Dewey said that the public, through government, has a right to regulate these harmful public actions. Acts that affect others are the public's business. No freedom is absolute. Freedom can be curtailed when others are affected, particularly when they do not choose to be affected. An ounce of prevention is worth a pound of cure. We have a serious infection problem now. Can you imagine what it would be if wearing of masks was voluntary? Wearing a mask is not that onerous. Sure, it may be uncomfortable, but getting the coronavirus can be more than uncomfortable. For those of you just joining us, we're reading the public comments into the record. A universal ordinance would take a burden off the individual business owner or organization. For example, a business may worry that if they enforce a voluntary mask requirement, customers might leave. A universal mask requirement would make the public, particularly those with pre-existing conditions, feel safer to go out. This would be good for public health. This would be good for business. If people stop wearing masks, even more will shop with Amazon. I would personally feel very insecure to go in public if mask wearing was voluntary. Such a universal mask requirement would be good for the economy. We don't want to have to close down again. If we don't deal with this problem now, closing down could well happen. We can stay open if people have to wear a mask. Isn't that a small price to pay for keeping the economy in Butte going? Because of an expectation of reciprocity, a mandated universal requirement to wear masks is more likely to be followed, thus making enforcement easier. People tend to comply with a universal government requirement, i.e. a law or regulation. The cost of wearing a mask, which is primarily some inconvenience, is far less than the benefits of mandating masks that would protect public health and the economy. While people should voluntarily wear masks, too large a number refuse to do so. We need to be protected from the harmful actions of a few, as other ordinances and regulations do. It is obvious that voluntary compliance is not working. Given this disease's perniciousness, we cannot hold the public health hostage to the harmful actions of the few. Therefore, there needs to be a mandatory mask requirement. Thomas Aquinas defines a law as an ordinance of reason for the common good made by him who has care of the community and promulgated. This definition certainly encapsulates why we need a mandatory mask requirement and need to continue into the new year the protective measures that are in place. Thank you. That was a comment from Dr. John Ray. Next comment is from Catherine McLaughlin. Karen, I would like to first thank you for your hard work and dedication. During this pandemic, you have worked tirelessly to keep the community informed and safe. I fully support the implementation of a mask mandate for Butte-Silver Bow. The pandemic is never going to end if we don't follow the science and the recommendations the scientists make. I encourage you to continue to take a stand to mandate masks. Once again, thank you and your staff for your dedication to our community. Next comment is from Bill McLaughlin. Hello, Karen. My name is Bill McLaughlin, a resident of BSB. First, I would like to thank you and your staff for all of your hard work and dedication to the citizens of BSB. My wife and I appreciate everything you and your staff has done to try to suppress the virus. I fully support the adoption of a mask mandate that is being considered by the BSB Health Board tomorrow night, December 22nd, 2020, based on information provided by scientists and health experts. Masks are one of the few tools available to prevent the spread of the virus. In addition, I believe it is a moral obligation as citizens of the community to protect the well-being of our neighbors. Please provide my feedback and support for a BSB mask mandate to the health board members. Thanks for your consideration. Have a happy and safe holiday. Next comment is from Marie Walsh. My name is Marie Walsh, and I would like to give my vote for a mask mandate for our state as well as Butte-Silver Bow. We have a long way to go before we're out of the woods with COVID, and people need to be safe and think about others' safety as well. Next comment is from Eddie Walker. I feel it should be mandatory masks in Butte-Silver Bow. We need to stop the spread of the virus. If it's good enough for Dr. Fauci, then it's good enough for us. It's not political. It's a matter of losing loved ones to the virus. The scientists know what they are talking about, and it's proven by wearing masks, it stops the spread. Next comment is from Julie Deschner, who owns several small businesses. Dear Karen, we have done the breakdown on the numbers of our 4 locations. On an average, these 4 locations lost approximately $177,661 in sales each. Most bars run on a 300% markup. Lost profit on each of these locations is $59,220. We have also had to take out EIDL loans that we will be paying on for the next 30 years, totaling $320,000. These loans do not reflect any profit whatsoever. Here is the individual loss of sales and gambling for each of our locations from January 1st, 2020 to December 22nd, 2020. Party Palace, $399,977. Ace High, $128,150. SBAC, $135,297, and Goodwill, $47,223. That's a total loss of $710,647. There are approximately 82 liquor licenses in Butte. If my estimates are correct, $14,618,202 has been taken away from bars and casinos alone and handed over to convenience stores, grocery stores, and liquor stores, causing an astronomical transfer of wealth from small businesses to corporations. All these locations pay brick and mortar taxes within our county limits and employ several hundred people. These jobs are generally minimum wage or just above. Bartenders make their living off tips. Many are losing their homes and assets due to the mandates. We would hope that you will stand up for businesses and their employees who are struggling during these difficult times. We understand the severity of this pandemic, and we know you too are struggling to juggle these difficult decisions. Removing the 10 p.m. mandate but keeping the mask and social distancing mandates would relieve extreme economic pressure on these locations and their employees and would resolve massive late night gatherings in homes where there are no mandates, creating direct contact by large gatherings. We are asking that you consider this solution for the next few weeks to test this method. Thank you for your consideration. Respectfully, Julie Deschner. And then there's an additional addendum from Julie. We appreciate you guys wanting these businesses, the businesses' input on all of this. I was speaking to Michelle Garcia, the owner of Mining City Taxi and also A&B Taxi. They went from running 8 cabs per day down to 1. Her hours have also reduced drastically. She now shuts her cabs down at 11 p.m. With her services and our free ride service being done at these hours, folks are now leaving house parties intoxicated on alcohol and drugs, either driving or walking. I wanted to give you her input on this as well because she is busy driving today and won't be able to phone or email you, but thought this should be expressed. Thank you for that, Julie. The next comment is from, pardon me, I'm gonna get a sip of water here. The next comment is from Christina Shepard. I am writing to express my concerns with all of the restrictions being put in place in regards to face coverings being required. I am truly incapable of complying with the face covering requirement due to having debilitating panic attacks when I do try to wear a mask or anything over my face. Under Governor Bullock's mandate, medical exemptions are allowed, but I have been told that you personally are not allowing for the exemption. I have been called a danger to society and kicked out of a store because of this. You are effectively making it impossible for me to provide for my family with this. If I could just wear a mask or a face shield, I would, but unfortunately things happened in my past and I'm not capable of doing so. I understand that there are those that refuse to comply because they feel it violates their rights, but not everyone falls into this category. I beg you to consider what effects your mandates and restrictions have on those in my position. I am more than happy to provide medical documentation of my inability to comply, as I have done previously, to be allowed the same access to services as everyone else. My family suffers as a whole due to my not being able to wear a mask or face shield, and that's not right. I only go out when necessary, and I am asking you to allow for medical exemptions. Please have a heart. Next comment is from Peggy Ryan via a telephone message. I am very sternly calling to say that I am in support of keeping the mask mandate in Butte-Silver. Next comment is from Joe Mihailovich. I absolutely think it is essential that masks be mandated in Butte for the upcoming months. I cannot attend the Zoom meeting, but want to pass on my opinion. Please mandate masks. It is the right thing to do. And then I have several more. Get the list here. Next comment is from Matthew Foster of 2500 St. Anne Street. Why are you people allowing Karen Sullivan to usurp power from elected officials? The meeting on Tuesday at 5 p.m. to change the rules clearly shows she knows that Montanans elected a new governor to end the restrictions. To stop the will of the people, she is changing the rules so she alone has the power to stop the restrictions. That is criminal. We the people have spoken, do your jobs, and let her know this cannot continue. Next comment is from Rick Strazi. I just wanted to voice my thoughts on the health board meeting today at 5 p.m. I am a business owner in Butte, Napa Auto Parts. Although we are surviving okay in this pandemic, as they call it, but there is a lot of small businesses that are not and are closing their doors forever. I think the restrictions placed on people is way overboard. I do think this is real, but the numbers that we are being told are not truthful. The media keeps reporting new cases, which is meaningless. The virus will spread and numbers will increase, but the majority of them are not even active or serious. There are a lot of medical doctors that have said that wearing masks are useless and more than likely the cause of other illness like bacterial pneumonia from breathing in the air that we are supposed to exhale. There is too much focus on the disease while the damage being done to businesses, society, schools, and people is catastrophic. And that doesn't even include the money being wasted by the government for the bailout money paid to people that can't work or won't work. I know myself and a lot of others are tired of playing politics. It seems more about control than anything. That was from Rick Strazi. Next comment is from Bonnie Canty, a retired school nurse. I want to add my support to the present COVID restrictions. I feel we are making gains with the present mandates, and any lessening at this time will cause an increase in cases. We are close to containment with the vaccines being administered, and I feel we need to be patient as we wait for that to be completed. Masks protect all, especially the most vulnerable. I don't want to go back to lockdown with closed schools, churches, and businesses. Thank you for all you and your staff are doing to keep us safe. Next comment is from Elizabeth Wasson, 723 North Henry Avenue. Please continue requiring masks. I can't believe I even have to comment on the policy. Thanks for all your hard work. Okay, that is all of the comments that I got. Oh, I think I might have one more. Oh no, I think that's it. Okay. Next, we will open up the phone line for public comments. And we do have a call.
Please state your name and address for the record and make a comment. Hello?
Past this group of Republican governors that was newly elected in Montana. So basically, you guys are trying to usurp the governor of the state and try to make these mandates permanent. That to me is unbelievable. So, I mean, I'm trying to find more information about exactly.
Welcome to the meeting. Please state your name and address for the record and make your comment.
Frank and Kathy Terrace, 133 Wrens Drive. And the comment would be to continue mass.
Is that it?
Yes, that's
Okay,
it.
thank you. Please state your name and address for the record and then make your comment.
Cheryl Petersley, 2724 Harvard Avenue, Butte.
Okay. And your comment?
My comment is that I believe if
Okay. Thank you to everyone who called in. We appreciate that public input. The next item in the agenda is our action agenda item to consider authorizing rules and regulations related to the COVID-19 event. Karen, do you want to give any remarks?
Madam Chair, thank you. Every Monday we release publicly our data report, and our data are, the metrics that we watch are greatly improved over the past month. Two primary metrics that we look for include our test positivity rate, which indicates how many people are testing positive for COVID-19 within any given time period. And the last period of time that we measured is 13.4%. About a month ago, that positivity rate was 31%, a little more than 31%. And so the county has greatly improved in regard to positivity rate. Again, Madam Chair, we are currently at 13.4%. We would like that under 10% and preferably under 5%. The other primary metric that we look at are cases per 100,000 population. Today, we are at 70. We would like that particular metric to be below 25. And so those two particular metrics we follow. We follow other metrics that we release to the media and other stakeholders every Monday. And the other things that we look at, we want to ensure that the hospital is not having a surge in regard to COVID patients that would really impact their ability to care for COVID patients and routine patients. So we follow that very closely in partnership with the hospital. The hospital is doing well right now. Mr. Parrish has put up some data for all of us to look at. And then, some of these data, Madam Chair, change hourly. And so what I'm reporting to you is what I have tonight. This data was created this morning for the Butte-Silver website. So even throughout the day, you can see data modifying over a few hours of time. We also look at how our critical access hospitals are doing in the region. Our little small rural hospitals, Anaconda, Sheridan, Montana, Ennis, Montana, Deer Lodge, they all feed patients to St. James. And if they're doing well, then, we have confidence that they're not being overwhelmed and that our larger regional hospital, St. James, is not being overwhelmed by rural patients as well. Those are among the data points that we look at. But again, positivity rate, we're at 13.4%. We want that below 10. And our cases per 100,000 population, we're at 70. We want that below 25. The movement in these metrics over the past month has been substantial and healthy and good. This community is trending in the right direction. And it is our fervent hope at the health department among staff that we continue trending downward. We feel like, people doing their part, merchants and retailers doing their part is all paying off. The health department now is moving, will remain in the paradigm of testing and contact tracing. After the new year, we'll be moving into a new paradigm of vaccinating, and we don't want to let up. We've got to keep doing what we're doing in regard to moving into the paradigm of vaccination. And we will begin vaccinating probably next week or the week after. The health department itself will receive a shipment of the Moderna product. Already the hospital is vaccinating, and our partners at Community Health Center and the North American Indian Alliance will be vaccinating as well. We're working under CDC guidance and state guidance on how to tier all of that. And as health department staff, we just are very hopeful that the community is trending very well, that we go into the new year with a full slate of protection for our residents as we begin to vaccinate. And hopefully by June, late May, we will have our lives back. And it is our fervent hope that we'll get there. So I think our community is trending nicely. We need to go into the new year wearing masks, which would be a mandatory mask mandate locally, and then a continuance of the restrictions that we have in place. However, we would lighten those if our metrics indicate a further positive trending.
Great, thanks so much, Karen. I'll open it up to discussion from other board members. Cindy, Commissioner Shaw.
Thank you, everyone. I know we have other members online. I don't see their faces, but I know they're there. Thank you, Karen, for your update, and Ivy, I like the way you capsulized everything in the beginning. I hope that the people that are listening in understand this is not punishment. We are actually trying to, I think our goal is pretty simple. If we can get our numbers down, then we can also reduce restrictions that all plays together in the same vein, and the idea that this is not a punishment. I hope people realize that. I'm on other boards where I'm trying to help people stay afloat. They're really getting close to being in dire straits with their businesses, and it's not a pretty picture for a lot of people, and I feel very bad for those folks. And I think that the people that wrote in, I thank them all for their comments, both, either way. This affects each of us individually. There is no blanket, arena here. It's very personal for each of us. But I do think that we need to remember we're not trying to inhibit or punish people or businesses, but we do see numbers going down. That is so encouraging. That plus the vaccine, I actually see this little glimmer of hope at the end of the tunnel. But yeah, it's a struggle for everybody. And I just ask people to please just hang in there. And it is scientifically and medically proven that masks work. It just seems to be pretty simple. And I think we have a very simple goal: reduce cases, and then in turn, we will reduce restrictions, or will be able to do so. But otherwise, I just think the status quo is just not. That's just my comments, and thanks everyone for being on tonight.
Thank you, Cindy. Any other questions or comments from other board members?
Ivy, can I just have a couple points of clarification, if that's okay?
Yep, absolutely.
So my first question is for Karen. Karen, are there other counties in the state that have enacted similar local mask mandates?
Excuse me, Dr. Cornell, I had to find the unmute. Yes, Lewis and Clark County last week issued the Board of Health there in Helena, continued current restrictions and established a local mask mandate. Missoula County, the Board of Health there established a similar rule. I believe Gallatin County has established a similar rule. In Yellowstone County, Billings, the health officer there issued orders moving into the new year with a local mask mandate and other restrictions, with the ability to manipulate the restrictions based on metric performance. So we're not the only community in line for doing this.
Excellent, thank you, Karen. And then just a point of clarification for one of the written comments. There was a person that said that she was concerned that this local health order doesn't allow reasonable accommodations. I've read the order. But can you just allay that fear and let everybody know that it is in line with the Americans with Disabilities Act?
Dr. Cornell, Madam Chair, yes, we understand that there are people living with disability for whom mask wearing is very difficult, and the order allows for ADA accommodation for people who simply find it untenable to wear a face covering.
Thank you. And then I just have two comments, not questions. So the first is that this is not a permanent order, as one of the gentlemen that called in said. I think that you've made it very clear that these restrictions will be lifted in a stepwise manner once metrics which are transparent and evidence-based are met. I don't think anybody on the Board of Health is excited to implement restrictions. We're doing this obviously with great consideration. And I think, I'm sure everyone in the health department is as eager as anyone for the pandemic to be over. So the first point of clarification that this is not permanent. And then it's sad to say this, but to the gentleman who commented about masks not working, as Commissioner Shaw had stated, the evidence is very good. It's not just the World Health Organization and the Centers for Disease Control and the local Montana State Department of Public Health and Human Services, or the health department, but numerous organizations stated that masks work, including the American College of Physicians, the American Medical Association, the American Academy of Pediatrics, the American Nurses Association, American Hospital Association. It's very clear that masks work, I cannot. So I think that's a small price to pay to hopefully expedite the resolution of this pandemic. Thank you.
Thank you, Dr. Cornell. Any other questions or comments from members of the board? I do have one additional point of clarification. There was a comment regarding authority for this, and that the governor should have this authority. The governor does have authority to set such regulations, but we also have that authority at the local level. There could be a federal mandate, a state level, a state mandate, a local mandate, and our authority is derived from Montana Code Section 50-2, just for those wondering. Okay, any further discussion from members of the board? If not, we will move on to entertain a motion. Would anyone like to make a motion to approve the rules and regulations related to the COVID-19 event?
Yes, I'll make a motion to approve the emergency rules and regulations in response to the COVID-19 pandemic dated 22 December 2020.
Second.
Julie Hart, second.
Oh, we've got 2 seconds. We'll go with.
Julie, I'll let you have it.
Thank you, Commissioner Shaw and Julie Hart. All those in favor of approving the motion, please say aye.
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 Any opposed? Thank you, board members. Motion carries. We have no other business tonight. We have no briefing agenda items tonight, just running through the rest of the agenda here. No presentations. Do we have any public comment from any items not on the agenda? Second to check here.
Comments from any items not on the agenda.
Welcome to the meeting. Please state your name and address and make your comment.
themselves instead of being enforced. And I think that businesses are being very good in complying out of fear of fines and being shut down, not because they want to do it. So let me finish. Businesses are being very good in complying out of fear of fines and being shut down, not because they want to do it. So let me finish. So I really feel that you have to look at the science behind all this, and also the testing is not good either. There are so many false positives that it's almost ridiculous to be able to count on those tests. So your data is skewed. And also the testing is not good.
Could you please turn down your speaker? We're getting feedback from your computer.
Turn the speaker on. So there's also a Johns Hopkins University study that showed the death rate has not changed for the last 3 years, even with COVID. Different things have dropped though. Heart disease, cancer have dropped almost at a perfect ratio compared to COVID. So I don't understand how you can just blanketly blame everything on COVID and put people through basically hell if they don't choose to want to wear a mask. People are responsible people. You can wash your hands and social distance, and I don't think the mask, the disease, the virus is 1,000 times smaller than human hair. All the masks that I see out here are not designed to stop that, in or out. I think, Dr. Cornell, you're a doctor, and you say they work, but we're not wearing masks that work. Most people have some that are homemade. They no way work. So how can you possibly feel good about forcing us into this mandate?
Thank you for your input, sir. Do we have any further public comment on any items not? Okay, that's all that we have for tonight. The next meeting of the Board of Health is scheduled for January 13th.
Ivy, we can't hear you. I can't hear you.
Oh,
Thank you.
sorry. Thank you. I'll state that again.
Moving, but
our next meeting of the next meeting of the Board of Health is January 13th at 7 a.m. And with that, I would entertain a motion to adjourn.
so
Meeting is adjourned. Thank you, everyone.
thank you. Thanks for everyone that called in, and
you.
thank the public for participating.
Thank you.
Thank you.